In today's video, we are talking about a healthcare crisis that is ripping through North America. We're not talking about the opioid crisis, we're talking about long COVID. This is affecting more than 20 million Americans, and it is changing lives by the second. Now, for those who find themselves ensnarled in its grips, the journey is neither simple or swift. Now, last year I produced a documentary called COVID, the Human Cost, and now I'm having a major update. We are joined by doctors who specialize in long COVID and one of his patients' journeys. This is a video you definitely don't want to miss.
Last fall, President Biden said the pandemic was over, even though this virus is still killing about 2,000 Americans every single week.
The pandemic is over. We still have a problem with COVID. We're still doing a lot of work on it. But the pandemic is over.
A much broader impact is being borne by the untold millions who survived their infection but now suffer from the troubling chronic condition of long COVID.
According to the CDC, a range of symptoms still linger in nearly 1 in 5 American adults. Those symptoms are debilitating, painful, and life-altering.
Physically, long COVID has absolutely just ruined my life. I mean, it really has.
I'm a fraction of the person that I had hoped to be, that I used to be.
I'm maxing out my credit cards.
We need to pay attention, and it's not just about suicide, it's about people re-entering the workforce. This is an economic issue, and I wish that the medical community would have taken long-haul COVID more seriously early on.
3 years after the start of the pandemic, some 16 million Americans have long COVID. An estimated 4 million people say long COVID has significantly reduced their ability to carry out day-to-day activities.
It's 9 million people in America with long COVID. They want to get back to work. This is not in their heads. This is not a disability scam. These patients just want to be themselves again.
Experts believe at least 10% of patients become COVID long haulers who suffer severe symptoms indefinitely.
The post-virus condition that can present with any combination of more than a dozen symptoms that appear after the patient tests negative. They can last from a few weeks to a few years.
44% of respondents with long COVID had considered suicide.
I was in so much pain that I quite literally fantasized about the million ways that I would end my life.
I've seen personally in my support groups multiple people that have died by suicide because the symptoms of their long COVID experience was just too much to handle, and they couldn't withstand the pain anymore. As you said, 1 out of 10 people, there's a tsunami coming, and my wife was one of the first, unfortunately, and there probably will be more.
Hi everybody, my name is Alex from Reportify Media, and this is an extremely important video that everyone needs to see. Share and subscribe, talk amongst your friends and family. This is some very serious issues here that we're going to discuss in today's program. I have Dr. Grossman on here and Amira Saleh, and that's a discussion about long COVID. Doctor, thank you for joining me this afternoon. It's been a difficult year there. I guess in the United States of America, you've suffered over, I believe, 1 million deaths to COVID, but this isn't the end of it. What we're dealing with at this time.
Yes, thank you, Alex. It's a pleasure to be here with you. I'm a medical doctor, allopathic medicine. I've been in practice since 2003, and I'm trained in anesthesiology and interventional pain management. I have been treating patients back 5 years, even before long COVID hit, for PTSD, post-traumatic stress disorder, with the stellate ganglion block. And that's an injection that's performed at the neck level, and it blocks part of the sympathetic nervous system that communicates with the brain. It just so happened that we started getting some patients coming in early 2020 that didn't have taste or smell. We didn't really think much about it, but it seemed to have improved after a stellate ganglion block. In other words, their taste and smell came back.
What part of 2020 was this happening?
This was early 2020. This was before long COVID was even called long COVID. We didn't know about it. We didn't know that there was a post-COVID syndrome. We were just learning about COVID at the beginning of 2020. Some of these patients were exhibiting some of the long haul, long COVID symptoms without even realizing why they were getting these things. So it just so happened that I was treating it for the PTSD, but it also helped with the smell and taste. And as time went on, I had kept seeing additional patients with neurological problems like brain fog, chronic fatigue, severe bouts of anxiety and panic attacks, abdominal pain, abdominal bloating. And as time went on, I did more research, and I was very interested in learning what this new condition was and what it was doing worldwide. And one of the things that really bothered me is when they went to seek to their doctors, nobody really knew what to do or what it was. They got referred to psychiatrists or psychologists. They had a slew of tests done. A lot of the tests will come back normal. And they had imaging done, and imaging will come back normal. And they have shortness of breath, but their oxygen saturation is normal. But nevertheless, they still experience that shortness of breath. And, I met Amira and decided to really do something about all these people kind of looking but never getting an answer, not taken seriously by the majority of the medical community.
I'm going to step in here for a moment, Doctor. I'm reading some statistics here that the number like 1 in 5 or 1 in 10 long COVID symptoms months and years after. Is there some legitimacy to those comments?
There is. Unfortunately, anywhere from 10 to 25% of people who contract COVID will develop long COVID.
In North America, I would say you have a population of 330 million. Majority or many of the people were infected. Let's say a person walked into a doctor's office or to a hospital that maybe was not insured or uninsured, came in there and they were misdiagnosed and they suffered a financial hit to their pocketbook from this. Is that reality?
It's reality, and I'll tell you why. There are at least 203 long COVID symptoms that have been documented. There's no specific test or imaging or anything that's diagnostic of long COVID.
What could the government have done to actually support you as a medical professional lower this infection rate with these people?
There's 56 million people that are known to have long COVID, but I bet you there's more than double that are unknown. So they're suffering in silence. They're very sick. They're home. A lot of them are isolated. They don't have anybody to help them.
Let me ask you, Doctor, while we're in this conversation, here in China, we had a very efficient contact tracing application system. We had nucleic acid, very expensive tests. They were done into hundreds of millions here to isolate it. And in fact, I would say the country of 1.5 billion came out of it with a rather soft landing. But in America, as I know, everyone was kind of left on their own.
Initially, people, the medical community was worried about the COVID infection itself. There was a lot of fear mongering. People were dying. Nobody really knew the exact death toll that was going on, how busy hospitals were. People were being placed on ventilators left and right. There was no room in ICU for people. One interesting side effect of this is people were going in to the hospitals. The Alpha variant was, the original Wuhan variant was particularly destructive. Delta was pretty destructive too, but there was some incentive for hospitals to put down cause of death was from COVID. Let me say financial incentive.
Wow.
So they may have had other reasons for dying or other reasons for having problems. As long as they tested positive for COVID, a lot of them, may have been documented as dying from COVID, and therefore the numbers became a little skewed.
Let's hear from a patient's perspective here. Let's bring in Amira to tell us maybe her situation, what she's experienced here. But maybe you could just share us what exactly you have gone through over the last few years. It's really important for our viewers to hear that.
Thank you for having me here. I had been watching the news like everyone else, November of 2019, trying to get any kind of information about what's going on with this virus and how many people were infected, how many people were dying. And those numbers kept increasing and increasing and increasing. So by April, I applied to get vaccinated. And sure enough, with a family history of asthma, I was able to be one of the first ones in our area to get vaccinated. And then 3 days later, I had some weird symptom that I did not know was a symptom that something could be wrong. I was folding laundry and my legs gave out and I landed in one of the laundry baskets. I did tell my doctor about this and she said, just to be sure, go to the ER. And I go to the ER. They go through and do all the standard testing and they did an MRI. it's chronic pain. Here's a pain tablet and go home. Now, mind you, those days you had to wait sometimes upwards of 24 to 36 hours to be seen because there were so many people waiting to be seen for COVID Delta variant. And I said, isn't there a reason why I would have swelling? Well, we don't know. I went home, and by end of April, pain starts getting more intense in my lower spine and my legs start getting heavier. And I said, what could be going on with me? I go back to the doctor. We don't see anything structurally wrong with you. I even was at a client site and had a loss of bowel. Small loss of bowel, and I didn't know until I got home. And imagine, you've never had to wear a diaper, but you wear one now just in case. I mean, your whole life changes. Called the doctor again. They said, don't bother coming to the ER. We have somebody with a broken hip. We have too many people with Delta variant sick, and we're not seeing anything wrong on your studies. Maybe you just need more time to heal. All these excuses. And I'm more and more realizing that I'm losing control of my body. Am I starting to lose my mind because I'm experiencing things like hearing this ringing in my head? My vision started to get altered, and I was back to using the cane because I was unsure of how steady I was. And they said, you have a lot of arthritis in your hands. So I'm having these shooting pains every once in a while, coming down my arms, down my legs. And the next thing I know, I'm staring at the ceiling. I just awaken and hear my son calling for my husband. Mom has collapsed. Help her, help her.
I'm really sorry that you had to go through something like that, and it must be very traumatic. Did you feel helpless at this point where the medical industry wasn't helpful, or were they just dismissing that maybe this was just all in your head?
I had been dismissed so many times and made to feel like I was just there for pain control or pain medication. And believe me, when I awoke from that fall, I was in a lot of pain. Nobody's coming to save us. We have to save ourselves, literally. Now imagine had I been driving, or imagine if I was a pilot. Any one of these instances could have happened, and it would have been completely devastating, not only for me, but everyone around me. That's what frightened me. I was so glad I had awoken, but every night became more of, am I going to wake up in the morning? I thought maybe I'd been poisoned by something, It really felt like my body was sick, and it was a sickness that I had never experienced before. So
I'm going to bring in a figure here. It was estimated the number of Americans with long COVID began at around 23 million.
That's probably more.
Yeah.
Not everybody. See, I mean, how do you get these stats from hospitals, from testing sites?
23 million.
Yeah.
Or more. That number is absolutely
It's more likely
staggering.
more. Yeah, it's more likely more. What we're talking about here is the long COVID, basically a minimum of 4 weeks after actual recovery from COVID. So you've recovered, but now you have either same or new symptoms start to occur. And like I said, it basically involves every system in the body, everything from chronic fatigue, post-exertional malaise, body weakness, temperature dysregulation. From the neurological standpoint, brain fog has been a big symptom that people have been reporting. There will be memory issues, short and long-term concentration issues, loss of what we call executive functions. When it comes to making some critical decisions, you can't do that anymore. Smell and taste. I mean, people made jokes about it during COVID, how do you know if you have COVID? You lose your smell and taste. But shortly afterwards, we learned that not only can it persist into long COVID, but it can become parosmia and dysgeusia, which is abnormal. So, normal things that you used to smelling smell nasty or abnormal to you now, and they don't taste right, so you can't eat, you vomit, or you get nauseated. And how do you describe this to somebody else? It just creates so many problems because there's no tests you can do to show somebody, hey, I got this.
But doctor, I mean, we've heard Amira's story here. It's very real. It's documented. She went through this. I mean, the medical professional, is the government there in North America Is this falling on deaf ears? Because we see in the media, we see protests that are going on. There are other groups that have protested even in front of the White House about this. The media suppresses this information. One point, you felt that maybe people just thought that you were making this up. Did you, or do you still feel at this time any support, Amira?
The only, every request went kind of on deaf ears. They weren't hearing me until when it took me a week to get the strength up, because at that point I could no longer walk. They drove me to the nearest academic hospital because they wanted to have the best chance of somebody listening. With all the studies that they happened to look at, could not figure out what was going on with me. And the tests they needed to do, they don't do in-hospital. What was that called? EMG studies?
EMG nerve conduction.
And they didn't bother to do a spinal tap to see what could be going on inside my spine. They did say I need to go to a rheumatologist and a neurologist that specializes in movement, and suggested I go to a physical rehabilitation facility for 6 weeks to learn to walk again. They ordered a wheelchair for me, and if they could not see anything immediately threatening my life, then it was up to me to figure out. A few months later, now mind you, it took me about 6 to 7 weeks to walk again. I mean, I was crawling to the toilet, lifting myself up. You know, I connect with everyone who has gone through that, who has long COVID. The struggle of feeling like you're a burden on your family, and then to other people. It was a really hard time for me, but I got a little better. And then my doctor's office said, you need to have a flu shot. You need to protect yourself. And I reluctantly had a flu shot, and that's when my symptoms worsened much more quickly. I developed what we now know as dysautonomia and POT, MCAS-related symptoms. I thought, I'm surely going to die, until one doctor said, well, maybe some people are developing myocarditis after vaccination. And then if you go and look at the fine print on vaccines, there's something called Guillain-Barré syndrome. So I started to research. I basically was watching medical school videos to understand what could be happening in my body and trying to get to the right specialist.
Where was the help for all these people during this, catastrophic time? This is what happened here.
Once I got involved in social media, I realized how widespread it was and how many people were suffering with this. So, at this point, I get between 150 and 200 between emails and instant messages of people asking for help daily. People were getting gaslighted by their medical providers. You're made to feel that what you're feeling is all in your head, that, the symptoms can't possibly be real and you can't possibly be experiencing them. Why? Because none of your tests come back abnormal. Your blood work is normal, your imaging is normal. It takes an active effort to learn about a new condition, to keep up with the studies, and see what's working and what's not. It's almost easier to just say, you know what, I can't find anything wrong with you. Go see somebody else. So, the person just wants to know, how do I fix this? How can I get better? And a lot of these clinics don't have an answer for them. And partly it is because nothing is really approved for long COVID treatment. You have Paxlovid, right? And Remdesivir, and there's a couple of antivirals that are approved. Everything else is off-label. And not every doctor is comfortable prescribing off-label or doing something, that the FDA didn't approve.
But what the hell happened in a country that cared about its people in this industry? If North America, and I'm going to include Canada in this as well, we failed dramatically in this.
I mean, in short, when we're talking about COVID, we were overwhelmed. I mean, there's just too many patients and not enough physicians and nurses and care.
I don't want to cut you off, and I'm not going to after this point, but there was warning shots coming over from Asia that this is coming. Get ready. And the current administration at the time just said, well, kind of like the flu.
Kind of judging based on other COVID related infections like MERS and SARS that we've had, they weren't as contagious and they weren't as virulent. So I don't think really anybody truly grasped how bad it was going to be.
And now, fast forward to 2023, we have stories like Amira's here.
Well, as you saw, the current administration says that the crisis is over. I mean, we're done. We washed our hands of it. Look, it could have been handled better for sure, but I do think some of the infrastructure problems. We have our masks and a lot of our consumable, what we call PPEs, personal protective devices, were manufactured outside the United States. Why? Because they're cheaper to manufacture outside the United States, whether in Korea or China or Mexico. And when some of these factories shut down or stopped exporting, we had a severe shortage.
What could we have done if you could redo this again?
There's certain things you just cannot do in the United States. I would have liked to be able to track better. And obviously, Apple has released COVID tracking app, but you have a choice of enabling it on your phone or not. Testing wasn't paid for by the government. You could have gone and got tested, but it would cost you money out of your pocket. Or some insurances may have covered it, I'm not sure. And same thing with the vaccines. There was really no vaccine mandate. And there's so much red tape in medicine these days. Dealing with insurance companies is a nightmare. But again, I'm pointing out that with long COVID, there's nothing really to confirm the diagnosis. There's just putting things together. It's not a psychiatric problem. Yes, it may come with anxiety, depression, PTSD as a result of developing long COVID.
If you had a message for the government, what would it be?
I don't know if I could say that on the air. The bottom line is, I'm really hoping that insurance will start covering some of the long COVID care, paying for some of the medications and supplements. We still need to do more on disability. And yes, it is absolutely a disability. Absolutely. There's no question in my mind. I see these patients every day.
Let's talk about Amira. Are you still going through more symptoms?
As it is, it took a year before I saw a doctor who finally put two and two together that I already had come to understand. I was working with doctors from Germany, India, Japan, all around the world. We were talking with each other and holding webinars. Some of us believe long COVID is a post-viral mediated autoimmune condition. Now, one doctor in Italy, Dr. Carlo Brugna, break discovery last year, and he published a paper on how SARS-CoV-2 has bacteriophage activity, which means it not only infects our cells, but it can affect some of the commensal gut-friendly bacteria that's in our guts.
Can we talk about how you treat it?
It's a passion of mine, and I do devote a lot of time to this. I change things in my practice, what I offer, how I offer it, what I test for. I've been doing a lot more naturopathic supplement and probiotic and gut health. Facebook group and the YouTube channel, mainly because two reasons. One is I saw a lot of people getting gaslighted and looking for answers and not having any place to get them. Why don't I help here? If you want to contact me for a consultation, the easiest way to do that is on covidinstitute.org. I've set up a system through Signal, an app, so we have a number people can text or call. I post 7 days a week on our Facebook group, which is called long COVID treatments and success stories. And
I'm definitely going to put all these links on how we contact you. You have some amazing stuff, Q&As in your podcast. I'm looking at the articles off to the left of me here. I commend you, Doctor. I appreciate your time. Thank you
so much.
All right, bye-bye. Well, I thank you for your time today.
Thank you so much. Take care now.
Bye-bye. We've just heard from a doctor and a patient on the struggles that our Americans are going through. Over 50 million Americans do not have access to healthcare, or at least the financing to take care of themselves. I appreciate everybody watching this program. Don't forget to click and subscribe. Thanks for watching.
Johns Hopkins is among the about 60 hospital systems in the U.S. with dedicated post-COVID clinics. Medical experts say that is not nearly enough to treat the up to 23 million Americans suffering long-term symptoms.
We still don't really know what we're dealing with when we're talking about long COVID. Long COVID should not have surprised us. We've been dealing with post-viral syndromes for a long time. For some reason, long COVID caught us off guard. We still don't really have a good hold on what is driving those symptoms. Other thing that we need to be thinking about in terms of who's impacted by long COVID, we know that certain communities were disproportionately affected by the initial phases of the pandemic in particular. So they have our Black and Brown communities had disproportionate rates of COVID. It then reasons to stand that they're also going to be more impacted by long COVID. And these are the things that we need to be really pressing as we're thinking about how the pandemic continues to play out in the US. And then we haven't even talked about healthcare access. Now we have a new chronic health condition that system is not equipped to handle, both in the outpatient settings and certainly in our safety nets, the emergency departments.
When we now talk about COVID, we talk about, the toll of hospitalization and death. That is really only the tip of the iceberg. What we now know, we know that COVID-19 can cause or can lead to increased risk of new onset diabetes and also new onset kidney disease. And what we know about these diseases is that they're really chronic diseases that don't go away.
What we understand very clearly is that this is not a psychological illness. This is not a psychosomatic illness. This is an illness that has been caused by the body responding to a previously unknown virus. The immune system has become very dysregulated as a result of the virus, and we need the government to start supporting a lot more in the way of infection prevention so that my clinic, which is currently overwhelmed, doesn't become even more overwhelmed.
Struggling to find treatment and doctors who understand what we're dealing with in the masses is very frustrating.